So guys, we shall continue our discussion on the humerus. Okay. So we shall continue our discussion on the humerus bone. Now when it comes to the humerus, first let me draw this part of the humerus and then explain you. Okay. Let us say this is the head of the humerus. Okay. And we have got the entire humerus bone all the way down. Okay. Now here if you see guys, you actually can find two important lines. Okay. So one line that is coming all the way like this, and there is another line like this coming down all the way. I'll tell you what is that, but first of all let me finish up with the picture part. Okay. And here you have got this round thing. Yeah. So if you look at the humerus here, so what are the things which you can find over here? What are the things which I can find is that this is called as the head. What is this called? This is called as the head of the humerus. This is called as the head of the humerus. Next important thing is that the center part, whatever you can see, right? There is a red line over there. There are two red lines, right? So in the center of the red line, whatever you can see this area here which I am highlighting, this area is called as bicipital groove. Bicipital groove. Okay. So there are two lips of this bicipital groove. For example, so you can see this as the humerus bone. This is the humerus bone here. Now in this humerus bone you can find this part. This is called as the head of the humerus. Okay. And this is called as the surgical neck of the humerus. Okay. This surgical neck is very important guys. Next important thing, just now I told you that this tubercle which you can see here, this is called as a greater tubercle, this is called as a lesser tubercle. Okay. In between both the tubercles, you have got a groove like this. You can see, right? I am putting my finger inside. You have got a groove. This is called as bicipital groove or intertubercular groove. Okay. Intertubercular sulcus or bicipital groove. So this is the bicipital groove here. Now in this bicipital groove, one thing is that you have got a lateral lip here, you have got a medial lip here. Okay. So if I wanted to show it on this paper, this is the bicipital groove. One side you have got medial lip, one side you have got lateral lip. Okay. One is called as a medial lip of bicipital groove, another one is called as a lateral lip of bicipital groove. So what is the other name for this? Other name for this is intertubercular sulcus. This is called as intertubercular sulcus, and after that this is called as the lateral lip. Okay. And this is called as the medial lip. One is called as the lateral lip and other one is called as the medial lip. And where is the surgical neck? I told you guys. So this part will be your surgical neck. This part is your surgical neck. Okay. Now very important thing you need to remember is that, why did I tell you about the medial lip as well as the lateral lip, is that there is a specific muscle that is attached to this medial lip. In the same way there is another specific muscle that is attached to the lateral lip. Okay. So how do I remember? Look here. Here let us say there is a medial lip here. Okay. So let us say this is medial lip and here you have got your lateral lip. And what is in the center? I told you, center you have got the bicipital groove. Okay. So let me write it down. This is your medial lip, this is your lateral lip. Medial lip and lateral lip. Center is your bicipital groove. So remember a mnemonic, that is a lady between two majors. Okay. A lady between two majors. Now what do I mean by a lady between two majors, guys? Lady, LA stands for latissimus dorsi. Lady, LAD. Okay. Lady in the sense LA. Lady in the sense LAD. LAD stands for latissimus dorsi. So in the center here, okay, in the center here we have got our muscle, that is latissimus dorsi. Latissimus dorsi. Okay. On the medial lip and on the lateral lip you have got two different types of muscles. Now what is the muscle that is located on the medial lip? Obviously it is a major muscle. Lateral lip also major muscle. But how do you remember it as? Remember it as MET, M-E-T. When I tell you M-E-T, M in the sense medial lip, Okay, ME in the sense medial lip, and T stands for teres major. So, medial lip side you have got teres major. Okay. Now, compare it with the lateral lip. On the lateral lip you have got pectoralis major. Pectoralis major. So, on the medial lip you have got teres major, and on the lateral lip you have got pectoralis major. Okay. So, this is all you need to know till here. Another important thing is that if you look here on the back of the humerus, you see a fossa here, right? This is called as olecranon fossa. What is this fossa? This is called olecranon fossa. And on the front side, you can look at two things here. You can see this rounded part here. This rounded part is called as capitulum. What is this rounded part called? Capitulum. And what is this wide part here? It is called as, this is called as trochlea. Okay. So, there are two things. This is called as capitulum, right? This is called as capitulum, and this is called as trochlea. And this is your olecranon fossa. So, on the anterior side here, as I told you, we have got two things, right? So, this one, this is called as your capitulum. Your capitulum. Okay. And next important thing is that this is called as your trochlea. One is called as your capitulum and the other one is called as your trochlea. One is called as your capitulum, another one is called as trochlea. And next important thing, guys, just above the trochlea you have also got a fossa here. You can see this, there is a fossa just above the trochlea. This is the trochlea, just above the trochlea you have got a fossa. This is called as coronoid fossa. Okay. So, here you have got a fossa like this, here you have got a fossa like this. Okay. This fossa I call it as coronoid fossa. Coronoid. This is called as coronoid fossa. Okay. Next important thing you need to know is that if you look at the epicondyles, right? So, this is called as a medial epicondyle and this is called as a lateral epicondyle. Now, compare both of them, guys. Compare both of them. You look, medial epicondyle here is more prominent in compared with the lateral epicondyle. Medial epicondyle is more protruding and prominent than in comparison with the lateral epicondyle, right? So, that is the reason why medial epicondyle fractures are more common, because it is more protruded out, right? That is more common. So, you have to know that here, right, here you have got lateral epicondyle here, okay, and the opposite side I cannot write it there, that is called as a medial epicondyle, okay. So, more common fractures are medial epicondyle fractures. What are they? Medial epicondylar fracture. Medial epicondylar fracture. So, what is the most common cause of medial epicondylar fracture? That is called as Fuchs injury. Fuchs injury is fall on outstretched hand, right? Fuchs, F-O-O-S-H, Fuchs injuries. Fuchs injuries means fall on outstretched hand. Okay. So, if you are falling like this, outstretched hand, on the outstretched hand if you are falling like this, there are more chances that your medial epicondyle might fracture. Okay. But more common than the medial epicondyle, supracondylar fractures are more common in the upper limb. Supracondylar means this is medial epicondyle, this is lateral epicondyle. So, above both the epicondyles, this region is called as the supracondylar region. See, exactly where my finger is going up and down here. So, this area is called a supracondylar region. Here the fractures are more common. Okay. These fractures here are more and more and more common. And how are they happening? They are happening that once if you fall on your outstretched hand, right, that is your Fuchs injuries, you will have this types of fracture. Fuchs injury. Fuchs injury. And second important thing which you need to know is that if you look here, guys, if you look here, this is a humerus, right? This is your humerus bone, okay? And this is your head of the humerus. Now, if you look at this bone, guys, I told you this is called as a surgical neck, right? So this part which I am holding it like this is called as a surgical neck of the humerus. So surgical neck of the humerus, okay, this region, this dotted region here, this is called as your surgical neck. Surgical neck. Okay. Now surgical neck of the humerus has got a nerve. It has got a nerve here. Okay. This is very important and all the time asked in your exams. Remember that there is a nerve that is running like this around the surgical neck. Okay. There is a nerve that is running around the surgical neck like this. Now this nerve, you name it as axillary nerve. This nerve you name it as axillary nerve. Okay. In the same way, if you look this part, this is called as the shaft of the humerus. What is this called? This entire part with whatever I am holding is called as the shaft of the humerus. On the shaft, you can find a small groove. I mean, I know that you cannot look at this picture right now. But so I can only see this groove, okay, because you cannot see it from the camera all the way. So there is a groove all the way running like this, okay. There is a groove all the way that is running like this. This is called as a radial groove, okay. Radial groove. Why? Because your radial nerve passes through that groove. So what I am trying to tell you is that, so there is a groove like this. So your radial nerve is passing like this through that groove, okay. And what is this nerve? This nerve is your radial nerve. This nerve is your radial nerve, okay. And from where this median nerve is passing, guys? Median nerve is passing exactly like this. See, median nerve passes down in like this, okay. What is this nerve here? This is called as median nerve. And next important thing is that this part over here which you can see, this is called as a medial epicondyle, right? So just behind the medial epicondyle, you also have another nerve that is passing down just behind the medial epicondyle, I told you, right? So that is called as ulnar nerve, okay. What is the nerve that is passing behind the medial epicondyle? This one. This is called as ulnar nerve, okay. So what are the nerves, guys? Surgical neck, axillary nerve, mid shaft of the humerus, that is a radial nerve. And next, exactly back like this from the medial epicondyle, you will have this ulnar nerve, and exactly from the center you have got the median nerve. Now why did I tell you this is that later on I will tell you. In the exams they will ask you a question that if there is a fracture of surgical neck, which nerve will be injured. They can also ask you if there is a fracture of medial epicondyle, which nerve will be injured. They can ask you if the fracture of shaft of the humerus, mid shaft of the humerus, which nerve will be injured. So these questions that can be asked in the exam definitely. Instead of asking those questions, they will directly put an X-ray for you and ask you which nerve damage is happened in this X-ray. Okay. So you have to be thorough with all of these important things. Okay. And also out of all these fractures, I have already spoke with you that the most common fracture of humerus, is supracondylar humerus. Supracondylar fracture is the most common fracture. So this is an important MCQ. Okay, important MCQ to remember for your exams. Okay, right. Now let us discuss about the ossification centers, guys. So in your exams, in your MCQ exam, right, either it might be your FMG or next exam, they are not going to ask you the ossification centers and all, but for MBBS exams, right, if you are a first year student watching my video, first second year student, then definitely you have to know about these ossification centers. Okay, so let us discuss about the ossification centers. Let us discuss about the ossification centers. So first important thing is that shaft. I already told you what are ossification centers, right? So if you look at the shaft here, Okay. In the shaft, when does the ossification center appear? The ossification center will appear at the 8th week of intrauterine life. Okay. It appears at the 8th week of intrauterine life. It appears at the 8th week of intrauterine life. Second important thing is that we have to discuss about the head, that is the upper end. So humerus has got upper end, lower end and the intervening shaft in between. Okay. So we have to now discuss about the upper end. We have to discuss about the upper end. Now upper end has got how many parts, guys? It has got head, it has got a greater tubercle, it has got a lesser tubercle. 3 parts: head, greater tubercle and lesser tubercle. Okay. So upper end has got what? Upper end has got head, it has got greater tubercle, it has got lesser tubercle. Okay. Now when will the ossification center appears in the greater tubercle? It appears in the first year. After the birth, in the first year, the ossification center appear. When will it appear in the greater tubercle? It will appear in the 3rd year. 3rd year, and in the lesser tubercle, it would appear in the 5th year. So first year, 3rd year as well as 5th year. Okay. And very important thing you need to know is that, all these 3, the head, the greater tubercle, the ossification center in the head, the ossification center in the greater tubercle as well as lesser tubercle, all of them together will fuse and they will form a conjoint upper epiphysis. They will form a conjoint upper epiphysis. So when are they going to fuse? They will fuse together in the 7th year. In the 7th year, all these 3 fuse. Okay, fine. So you are telling me that there is a ossification center in the head, in the greater tubercle and in the lesser tubercle. All of them are fusing. So it would take 7 years for them to fuse. Yes, they will fuse in the 7th year. Then when and after fusing, they 3 will form the upper epiphysis. So that is the reason why this region is called as epiphysis. When will the epiphysis join with the shaft? That is important. Okay, when will the epiphysis fuse with the joint? Because I also told you that here also you will have an ossification center. So the upper ossification center and the lower ossification, both of them have to join. When will it join? They will join with the shaft. They will join with the shaft at 20th year. They will join with the shaft at 20th year. Okay. So these are some of the important things you need to know. And next important thing is regarding the lower end. So we are done with the upper end, right? Now we shall discuss the lower end. So in the lower end, what are the different parts you have, guys? In the lower end, I have got capitulum, I have got trochlea. If you carefully look at this picture, in the trochlea there are 2 parts. So this part is called as the medial half of the trochlea. This is called as the lateral half of the trochlea, and this is capitulum. Okay, capitulum and trochlea, medial half and lateral half. Next, what is there in the lower end? Medial epicondyle, lateral epicondyle. So 1, 2, 3, 4, 5. 5 things are there here, right? So what are those 5 things, guys? Just have a name about it. So one we have is the capitulum. Capitulum, right? And next one we have is the trochlea. In trochlea also I told you there is one lateral side of the trochlea and there is one medial side of the trochlea. Medial side of the trochlea. And after that I told you we have got lateral epicondyle and we have also got medial epicondyle. Now when are the ossification centers appearing in this bone? Okay, so that is very important. Now when are the ossification centers appearing in capitulum, guys? So in the capitulum, the ossification center appears at 10th year. At the 10th year. Not only that, in the lateral part also it appears at the 10th year. Okay. When it comes to the medial part of the trochlea, it appears in the 12th year. It appears when? In the 12th year. And when it comes to lateral and medial epicondyle, it will appear in the 6th year. It will appear in the 6th year. Okay, so this is very important to know. It will appear in the 6th year. So these are the ossification centers which you need to know, guys. Simple, very simple, guys. Ossification centers are present in the lower part, in the upper part, in the shaft. Okay, in the upper part we have 3 parts. Head, we have got greater tubercle, we have got lesser tubercle. So in the lower part, how many parts you have got? You have got medial epicondyle here, you have got lateral epicondyle here, you have got trochlea, you have got capitulum. So if you remember these numericals here, so that would be pretty easy for you. Okay, guys. Now let us move on to the next important bone, that would be radius as well as ulna. We shall discuss about the radius as well as ulna. In the radius and ulna, only one very important thing you need to know is regarding the fracture of radius and ulna. So regarding the radius and ulna, guys, only 2 important things you need to remember for your exam point of view regarding the radius and ulna. That is, there are 2 different types of fractures, guys. What are these 2 different types of fractures are? One is called as Colles fracture, another one is called as Smith fracture. Colles fracture and Smith fracture. There are also different fractures like Gheilazy, Montague and all. So those you will remember in those they will be taught in orthopedics. But here you should mainly know about the Colles fracture as well as Smith fracture. Now in this Colles and Smith fracture, how do you remember is that Colles fracture, in Colles fracture the radius bone is directed upwards. Okay, in Colles fracture the radius is directed upward. Okay, as you can see in this picture, this is the radius bone which is directed upward. Okay, if that the same radius bone, if it is directed downward, that is called as Smith fracture. For example, look here, the radius bone is directed downward, that is called as a Smith fracture. So Smith is the opposite of Colles fracture. Okay, so in Colles fracture what is happening? So the radius head is directed upwards, whereas in Smith fracture it is directed downwards. The opposite of Colles is Smith, that is the radius head that is directed downwards. Okay, so let me also write it down. So this will be your Colles, whereas the radius is directed upward, and this will be your Smith. And another way also you can remember that, I mean, this is how you basically remember it. Okay,